During her January hospital stay just weeks before her death, Kaidence displayed several signs and symptoms of bleeding in her brain, such as nosebleeds and blood-tinged spinal fluid. While doctors were concerned, they allowed their concerns to be alleviated once Kaidence seemed to begin feeling better. Although Kaidence's lab results for meningitis were allegedly negative, doctors still should have given Kaidence a CT scan to further investigate why her spinal tap produced blood-tinged fluid, but they failed to do so. Kaidence arrived at the hospital on February 20th with symptoms of brain herniation, which Dr. Mehta described as her skull's inability to contain her brain due to swelling. A CT scan of Kaidence's brain revealed what Dr. Mehta referred to as chronic subdural bleeding, which is bleeding that had been on and off over the past few days to months. There was also a collection of fluids due to the pools of blood attracting water. A typical occurrence with chronic subdural bleeding, according to Dr. Mehta. During trial, the state's two medical experts offered contrasting medical opinions for the cause of Kaidence's brain bleeding. Dr. Mehta insisted Kaidence's brain bleeds were caused by shaken baby syndrome, while Dr. Darasaw asserted they were due to inflicted trauma by another. The prosecution also discussed whether Kaidence's brain bleeds could have been caused accidentally, but never specifically addressed the possibility of a bleeding abnormality, even though pediatric infectious disease specialist Dr. Mani suspected Kaidence may have been suffering from a possible bleeding disorder. Brain herniation is often fatal, and it undoubtedly contributed to Kaidence's death, but inflicted trauma is not the only cause for chronic brain bleeding and the subsequent collection of fluids that can lead to herniation. Brain bleeds can also be caused by blood vessel abnormalities, clotting disorders, and infections, all of which were real possibilities that were never explored with Kaidence. Kaidence's previous doctors completely ignored Dr. Mani's specific recommendations to test her for 4 different bleeding disorders, and they never learned the cause for Kaidence's high liver enzyme levels, which was a clear sign of infection. Furthermore, Kaidence had no retinal hemorrhages, which is a common sign of inflicted head trauma and shaken baby syndrome. Hours after Kaidence arrived at the hospital unresponsively on February 20th, Dr. Renuka Mehta observed fingertip bruises on her chest and reported suspicion of child abuse immediately, despite Kaidence having undergone approximately 3 hours of CPR by several different people who used various techniques of chest compression. Patrick, Kaidence's father, began performing CPR shortly after 1 p.m., and paramedics stated they continued to perform CPR non-stop until about 8 minutes before their 4:25 p.m. arrival at the hospital. In his interview with investigator Langford, Jerome explained and demonstrated the various CPR techniques used, including the use of palms, fingers, and thumbs. Paramedics also admitted to 3 failed attempts at placing an IV into Kaidence's right leg. This sequence of events, combined with Kaidence's undiagnosed medical condition that caused red spots to appear when she was unwell, could explain the fingertip bruises in the middle and sides of her chest that appeared later that day, but Dr. Mehta insisted the bruises were an indication of abuse. While performing Kaidence's autopsy on March 1, 2013, Dr. Laura Darasaw discovered an injury to Kaidence's mouth where it appeared Kaidence had bitten down on the tip of her tongue. Despite documentation of an identical injury in Kaidence's previous medical records from her January hospital stay, Dr. Darasaw described her findings as unusual and provocative. Dr. Darasaw concluded the injury was caused by a manual compression of Kaidence's mouth that was sustained before she arrived at the hospital on February 20th. Dr. Darasaw stated Kaidence had bitten her tongue so hard it was nearly severed. However, not a single person that encountered Kaidence between February 20th and the date of her autopsy observed an injury to her tongue. Kaidence's father performed mouth-to-mouth on Kaidence for several minutes before the first responders arrived. Zachary Bradford testified that he placed an oral airway in Kaidence's mouth and described how he literally pulled her tongue forward and out to position the airway device. Although Zachary Bradford stated Kaidence was too small for a breathing tube to be placed, paramedic William Holstein removed the oral airway placed by Zachary Bradford and replaced it with a breathing tube, which he later had to adjust the positioning in Kaidence's mouth. EMS spent a considerable amount of time alone with Kaidence in the ambulance outside of the Hughes home on February 20th while trying to revive her. Kaidence then spent an entire week in the hospital. intubated and being monitored daily by several doctors prior to her February 27th death. The notion that Kaidence could have sustained an injury as severe as what Dr. Darasaw described without anyone seeing the injury over the course of an entire week is unconvincing, to say the least. When Dr. Darasaw was confronted with the unlikelihood that no one observed Kaidence's tongue injury before her, she attempted to first downplay the injury by stating the injury would not have looked the same on February 20th as it did during the autopsy. Dr. Darasaw then proceeded to speculate about the environment surrounding rescue efforts for Kaidence, stating paramedics and doctors may have missed Kaidence's tongue injury due to a heightened state of panic and chaos. Another uncompelling explanation given the first responders and doctors all testified at trial as trained and highly experienced medical experts. The state's most convincing evidence presented to support prolonged child abuse was undoubtedly Kaidence's rib fractures. But the problem with Dr. Darasaw's conclusion that they could have only been caused by someone forcibly squeezing Kaidence's chest is that Kaidence spent several days being cared for by different people at various locations when her rib fractures would have occurred. Dr. Darasaw determined Kaidence had one rib fracture that occurred approximately 30 days prior to February 20th, 12 fractures that occurred approximately 10 to 21 days prior to February 20th, and one fracture that would have occurred as early as February 20th, or 1 to 2 days prior. Based on Dr. Darasaw's determinations, Kaidence would have sustained her first fracture on January 21, 2013. The day after she arrived at the ER, and the first day she was admitted into the hospital and underwent a spinal tap procedure where her chin was pushed to her knees while she screamed in agony for several minutes. 12 of Kaidence's rib fractures would have occurred between January 30th and February 10th. Kaidence would have been staying with a family friend for the entirety of that time frame, while Danielle traveled to New Orleans to be with family and help with funeral arrangements for her brother who had passed away on January 26th. Kaidence's last fracture would have occurred between February 17th and 20th. She would have been staying with the Hughes and being cared for by her biological parents, as well as Jerome and Danielle. If Dr. Darasaw's conclusion that Kaidence's rib fractures were caused by someone forcibly squeezing her chest, then Kaidence would have been experiencing the same exact abuse at the hands of several different people while staying at various locations over a 30-day time span. A theory so improbable it undoubtedly could not have been considered in charging Jerome or anyone else with a crime of child abuse.